After mentioning the different ways strokes are diagnosed, it is now time to discuss the treatment process for strokes. The treatment for a stroke will be determined after a confirmed diagnosis of the type the patient has. The most common type, ischemic strokes, occur due to a blocked or narrow arteries, so treatment will focus on restoring blood flow to the brain. The gold standard treatment for ischemic strokes is to use an IV injection of tissue plasminogen activator, or TPA for short, but it is also known as Alteplase. This injection of TPA is usually administered through a vein in the arm and needs to take place within 4.5 hours from when symptoms first started. TPA is very effective at dissolving clots that may have caused the ischemic stroke, but becomes less effective the later it is from when the stroke began. There are also two procedures involving the use of a stent, which is a tiny expandable metal or plastic tube that can be inserted into a blocked passageway to keep it open. The first ischemic stroke treatment that uses a stent is a mechanical thrombectomy. This procedure must be carried out within 6 hours of symptoms starting, and is usually only used if the clot occurs in a large blood vessel and can't be completely dissolved with TPA. During the procedure, a catheter attached with a special type of stent, a stent retriever, is inserted into the blocked blood vessel. The stent then opens, grabs the clot, and is pulled out of the vessel. The second procedure that uses a stent is angioplasty. This is done to open up an artery narrowed by plaque and can reduce the risk of having another stroke. The procedure involves inserting a catheter attached with a small balloon and a stent into the narrowed artery as demonstrated in the second diagram. The balloon is then inflated, causing the stent and artery to expand as well. The stent is then left in the artery to support it and keep it from narrowing again, while the balloon is removed, as seen in the fourth diagram. The other main type of stroke, hemorrhagic stroke, is characterized by blood leaking into the brain, so treatment will focus on controlling the bleeding and reducing the pressure on the brain. The first step to treating hemorrhagic stroke usually involves medications. Patients may be given drugs that reduce pressure in the brain, control overall blood pressure, as well as prevent seizures and spasms of blood vessels. The next part of the treatment will depend on the cause of the stroke. Occasionally, a surgical procedure called a craniotomy may be needed to remove any blood from the brain and repair any burst blood vessels. During a craniotomy, a section of the skull is removed to allow the surgeon access to the source of the bleeding. The surgeon will repair any damaged blood vessels and ensure there are no blood clots present that may restrict the blood flow to the brain. After the bleeding has been stopped, the piece of bone removed from the skull is replaced, often by an artificial metal plate. If the stroke is caused by an aneurysm, there are two treatment options available, and as stated in a previous video, an aneurysm is a bulging, weakened area in the wall of a blood vessel. The first treatment is surgical clipping. During this procedure, a surgeon will place a small clamp at the base of an aneurysm to stop blood flow to it and keep it from bursting or bleeding again. The alternate option is called endovascular coiling. This involves guiding a catheter to the aneurysm and filling it with detachable coils. This blocks blood flow into the aneurysm and makes it shrink. After treatment, stroke care focuses on helping the patient recover as much function as possible and return to their regular activities. Most stroke survivors undergo a rehabilitation program, but every patient's recovery is different. Depending on their conditions, the treatment team may include a mix of a neurologist, physiatrist, physical therapist, occupational therapist, dietitian, psychologist, speech pathologist, or social worker. A physiatrist will most likely be in charge of the rehabilitation process and will take into consideration the lifestyle, interests, priorities, the availability of family members, and many other factors to create a specific program for the patient.